Good Thursday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to those who are planning safe and healthy ways to make the most of this winter season. While the weather is good, take advantage of the outdoors. Visit some of our local greenways or just simply hang out in the backyard. When planning for your holidays, be creative about making it special while also safe. Try a virtual cooking lesson with your family members, who live out of town. Pick one Thanksgiving recipe that is a staple in your family and have everyone bake it together and hang out on Zoom while they do it and see whose finished product looks the best. We know holidays will look different than the years past. But that doesn't mean you can't still create memories. Over the next few weeks, we will continue to share fun ideas that you can implement into your lives to keep you connected with your loved ones while also staying safe and healthy. We will be holding our next public flu vaccination clinic today from 3 to 6 p.m. at the Carter Senior Center on Asheville Highway. We will have both flu mist and flu shots available, but we will not have the high-dose flu vaccine. Flu vaccines will be given to children 6 months and up, as well as older kids and adults. If you haven't received your flu vaccine yet, make plans to attend this event and get your flu shot. Getting your flu shot is very important. Is important every year, but it's extremely important this year. It's important to keep you and your loved ones safe and healthy. It's also critical to help keep our hospitals from getting overburdened with flu and COVID. Typically, flu season is the time the hospitals are crowded and have more patients. On top of COVID, the flu hospitalizations could quickly overwhelm the system. Sorry, I'm stumbling this today. So please, if you hadn't already gotten your flu shot, go to this clinic, go see your doctor. I don't care where you get it, just get your flu shot. The next Board of Health meeting is Tuesday, November 10th at 5 p.m. Public forum will be held at this meeting. More information on how to register for public forum will be sent out tomorrow with the agenda and media notice. You may watch the meeting live on Knox County's YouTube page, community television, or the Knox County website. Now I'll move on to the local situation. We have 182 new confirmed cases since yesterday's report, giving us 13,741 confirmed cases of COVID in Knox County since March. Additionally, we have 698 probable cases. 12,881 of our cases are considered inactive, giving us 1,447 active cases. 69 Knox County residents, 491 individuals have been hospitalized at some point in their illness. 69 Knox County residents are currently hospitalized. And unfortunately, we have 2 additional deaths to report today, raising our total to 111. Now I'll transition to the benchmarks. As a reminder, the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. All of this data that we are going to talk about is on our website. You can find it at covid.knoxcounty.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we experienced 7 red flags, only 2 of which were on consecutive days. We have seen an average of 119 new cases per day over the past 7 days and 122 new cases per day over the past 14 days. Because of these factors, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we utilize 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report data. Regarding testing, there were 7 red flags and 1 yellow flag, during the last 14 days, but they weren't on consecutive days. Since the beginning of October, overall testing has trended consistently, but at a lower volume than we'd like to see. Regarding lab turnaround time, there were 4 red flags and 1 yellow flag noted in the last 14 days. 3 of these red flags occurring on consecutive days. We continue to see stable numbers for test turnaround time between 2.5 to 2.8 days. With three of these flags occurring on consecutive days. Because of these factors, we are continuing to represent this benchmark as cautious yellow. Our third benchmark, sustained or increased public health capacity or capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours of being notified of the case and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in this desired time frame. Because of this, our benchmark continues to be represented as green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During the past 14 days, there were no flags detected for COVID positive inpatients, ICU patients, or ventilated patients, indicating a stable or possible decreasing trend during this time period. After speaking with our hospital partners, they have recommended that this benchmark remain a stable yellow. Compared to what we have seen in previous weeks, these numbers are heading in a positive direction. However, we still want to stress that our community members need to remain vigilant in practicing the 5 core actions and get a flu shot to ensure these numbers don't trend back up. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use the graph that shows the reported deaths in Knox County residents by date of death. Over the past 2 weeks, we have seen 10 deaths related to COVID-19. The information available leads us to represent this benchmark as yellow. Under the supplemental data section, the first chart shows new daily COVID cases per 100,000. As of yesterday, our 14-day trend line shows 25 cases per 100,000. And our 7-day trend line also shows 25 cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive tests in Knox County is 11.77%. I'll now open it up for questions.
All right, as a reminder, go ahead and media can submit their questions into the chat feature. The first question we have is from Alan Sims with Inside of Knoxville. Looking at the Knox County metrics, the colors are overwhelmingly yellow, meaning caution. At the same time, the White House task force has rated Knox County red and the county most adversely impacted by the virus in the state. Understanding that the metrics in use in each measurement are different, what would you advise residents to follow in making decisions like returning their children to school with the deadline looming for that decision? And more generally, should we be cautiously concerned in Knox County or alarmed?
Good question, Ellen. I think the most recent White House report does actually list us as orange. But regardless, what Knox Countyans need to know is that we have community-wide spread of COVID, no matter where you live, no matter where you are. And everybody needs to continue to practice the 5 core actions. And they have to assess their family's needs and their family's risk about whether children go back to school and what they do in their lives. I don't think there's a need for alarm, but I do think we all need to be very cautious and respect COVID-19. It's still in our community. and be thoughtful about that and understand that all of us are at risk for getting COVID-19, but we can take lots of precautions to prevent or to reduce our risk and reduce the burden of disease throughout our community.
From Vincent with the Sentinel, you said that in testing that you had a 3-day trend of red flag days and turnaround time, which would indicate a trend. You also said that in cases you had 2 days of red flags consecutively among 7 red flag days. It does not appear to matter whether red flags are occurring consecutively. If a trend in one benchmark doesn't trigger a red light shift and many red flags discontinuously don't constitute a red light shift, what does?
We use our statistical significant shifts for that. And that's based on what we do for trending for lots of other things when we're watching ER, emergency room data, for trending for syndromic surveillance. If we see those trends, it triggers a flag for us. And we also take into consideration other things as well. But we really are looking for that 3-day consecutive statistically significant change, but also the context and the situation.
From Megan with WVLT, have Knox County polling places been able to report their ability to follow the 5 core actions during voting? And have any cases been linked to any Knox County polling places?
Well, to answer your last question, not to our knowledge. And I can only anecdotally report what I observed when I went to vote, which was everybody wearing a mask, observing physical distancing, regular cleaning, very good allegiance to the 5 core actions by the voters and by the poll workers as well. We were in conversation with the Election Commission and supported them as they made decisions about what they needed to do to protect the public and protect their poll workers.
From Jeff with WATE, KCHD's active case count rose by 163 out of the 182 overall case count increase today. That's on par with some of our worst days back in the summer. Why so bad today?
So I'm a little confused. The 163 was that?
We had 182 new cases
today,
yesterday.
Right.
Yes.
What was the 163 reference?
The active case count.
Oh, okay.
By 163.
My bad. I'm sorry. So I can't get back to you, but what I do know is that we have had a local lab who was not consistently reporting COVID-19 to public health as required by state law. So there's a list of reportable diseases. It's rather long. Some of them need to be reported within 24 hours. COVID is one of those. It needs to be reported to public health, either the Tennessee Department of Health or here at Knox County, within 24 hours of the lab or the doctor's office knowing that they have a case. That was not happening consistently with one provider. The state has, they've changed what they were doing. So we did get a lot of reports from that one provider, some of which were older than 1 day, and some of them were several days old. So we're hopeful that that will kind of settle down when they get into their rhythm and are reporting to us on a regular basis.
Also from Jeff with WATE, one recommendation from the White House task force was to stop all gatherings beyond the immediate household until cases decrease significantly. That's quite a step beyond the state's recommendations. Is it too far, and is that something you would advocate? So
decisions on policy recommendations are made by the Board of Health, certainly, and the Board of Health gets that White House report, and they've seen that and take that into consideration. If you've watched our meetings, we do deliberate what can we do that will make a difference. I think one of the challenges with that recommendation, though, is honestly, how do you know people are doing that? We certainly can make that recommendation. We've made recommendations about sticking with your family unit and trying, trick-or-treating with your family unit and trying to limit your exposures outside your family unit. But those kind of recommendations are really challenging to monitor and implement, and knowing that people are actually doing it. But we do want people to limit their exposures and practice the 5 core actions wherever they are.
From Vincent with the Sentinel, what else should people keep in mind as the holiday season approaches?
Well, I think you need to, obviously going inside, the weather's cooler, we're going to be inside more often. how do you limit exposures with that, and doing things that they can do inside to decrease risk, like practicing the 5 core actions and, wearing your mask, even if it's uncomfortable. If you're in a situation where you're with family or friends and you can't maintain 6 feet of social distancing or physical distancing, you need to keep your mask on to reduce risk for everybody who's there. I know that's awkward and hard to do. Also, getting plenty of rest, all the things we tell you to do to stay healthy, getting plenty of rest, eating a well-rounded, healthy diet. And when the weather permits, get outside and get some physical activity and get a nice dose of vitamin D. All of those things will help keep you healthy during COVID and outside of COVID as well.
Also from Vincent with the Sentinel, there's been a very clear divide between people who do and do not take the virus seriously. How should people take this into account when planning for the holiday season?
It's a great question. I think what I would say is, make your choices about how you want your holiday event to be. And, if you have friends, let your friends know up front, or your family know up front, here's how it's going to be. I'm going to ask you to wear a mask. You're going to be seated by families. We're going to maintain 6 feet of social distancing, and let them make the choice of whether they want to attend that event or not. Don't make it into a battle. There's enough divisiveness already in our community. So be generous with each other. People make choices not to attend events. Give them some grace. If people make choices to make their event 5 core action centric, give them some grace as well.
From Jeff with WATE, can you tell us which lab was not reporting? Any explanation why, and will there be consequences?
That regulation is done by the state of Tennessee, so I don't have that information.
All right, any further questions, please go ahead and submit them into the chat feature now. All right, I'm not seeing any other questions come in, so thank you all for your time, and we will see you again on Tuesday at 12:30. Have a good rest of your day and a good safe weekend.